So a lot of people have asked me, why do you think our industry is broken? Why do you think some of the best and biggest companies of the past are struggling so hard today? What's happened? What's gone wrong? For me, I think again, this is just my thinking, going to be controversial. Some of you are not going to like it. Argue with it. Tell me you argue with it. But I think there's several things that have happened across our industry that have totally ruined what was a brilliant industry. Now, the first thing I want to talk about is the fact that what I do believe is that a lot of management, senior management, have allowed an insidious rise of people who are career managers, career political managers, where basically what they do is they manage their careers, they manage their positions, they're about them, not about the patient, not about the company. And too many management teams have allowed these people to come in, and it all becomes a big political game. So then what often happens is you've lost the people with competence. So the people who really knew the operating room, the people who really knew the procedures, the people who really understood the surgeons, they understood the daily life of the nursing teams, the hospital management. And a lot of companies, they brought in consumer people or pharma people, or they brought in people from other industries because they'd fix it, right? And what's happened is there's been a drain out of the companies, especially at the senior levels, of competent people. And I mean really competent in surgery or in medical devices. So then what you end up with is a lot of people come into the company at lower levels that are not given the support, the training, are not told what the important things are. Instead, they see examples that the important thing is politics. The important things is trying to work your way to the top. They don't understand that the deep insight into the hospitals, into the customers, into the day of the customers is really what counts. So you end up with a weird thing where people don't understand the business. They don't fundamentally understand the business. And honestly, that's a big problem in our industry. There've also been a lot of people who've not got the connections with the customers. They've not understood that. And they've not understood that investment is critical. Investment into education, investment into marketing of ideas and marketing with the customers, new innovations. There's been this kind of slow drain that it's being all commoditized. And that's a problem. You've got people in medical devices who think that, it's all about the margins and the commodity. That is not what causes success in medical devices. Now I'm going to name one company and everyone's going to, Steve's saying it again. I watched the rise of Intuitive. They are the opposite of what everybody else is doing. They are sectorially focused. Gary and Dave and them at the top. If I ask them the intricacies of how Intuitive and how Da Vinci is used within something like a colorectal procedure and what the problems are and what they're trying to solve, they'll know it, they'll say it, they'll understand it. Well, they are sectorially understanding their business. They are not about just compressing margins. They are not about just flogging a product. If you go to Gary or Dave Rosa and you ask them super deep questions, technical questions about how that robot is used day by day in the operating room, the difference is they'll be able to tell you every single nuance. They're not just business people. They are really 360 complete people who understand it. And that's the problem with the industry. We've got too many managers in the management positions who, number one, don't understand the business. Number two, they don't really understand the nuances of the business and the products and the procedures and the surgeons and they just don't understand any of that. And third, you've actually got a lot of people up there who are politicians, but they don't understand business. They really don't understand how to run a medical device business. Instead, what they're basically doing is they're just basically managing their careers, and everybody knows it. And you've got a lot of good, talented people that have remained in the companies. But the problem is they're delusioned, they're demotivated, they get frustrated. They hear people talk about nonsense in the quarterly reviews. I mean, utter and total nonsense in the quarterly reviews. Instead of talking about the real issues of what's the problem with the business. So it's no surprise to me that businesses that through the 90s and the 2000s were doing really, really well, there's been a slow degradation as they've allowed it to become commoditized. They've allowed it to become political. And really, it's all about the show and the tell to the investor world or to the outside world, instead of having a real deep focusing on the customers. There's not the deep investments into the customers anymore to support the customers and grow the customers. Training and education is one of the most important things. And I've seen a gradual decrease. They teach them how to basically use the product in the most basic way and try and do it as cheap as possible, instead of really trying to help people to understand not only the product but the procedure, the environment that the procedures are done in, and so much more depth about the industry. The industry is not supporting enough to do that. So what's happening is we're just seeing this commoditization, and it's no wonder that hospital management think that there's little to no value with it. So it's no surprise to me that then they're not really interested in working with the companies, and it's just really about give me a tender, give me a price, give me a quote, give me your best offer, give me your lowest price, because they're not feeling connected to the companies anymore, and they certainly don't feel connected to the management. Customer intimacy. I think when I speak to the customers out there, they feel that some of these big companies have lost their mojo. Yeah, they have a good relationship, or they used to have a good relationship with the reps, but now they don't. They don't feel they've got that intimacy anymore. I mean, in my day, you would train the people, you would take them through, you would hold their hand, you would build the business with them, you would build their career with them. I don't feel that that's being done as much as it could have been. And I think, again, that's because the management teams don't understand the value of it. They are saving money on the wrong things. They are not understanding where the investment should go. They're not supporting the community. But Intuitive is. I saw that. Intuitive Connect 2024. That wasn't just pumping a brochure and trying to sell. That was bringing together a community of people that were trying to really understand health economics. We're trying to understand how you run programs. We're trying to understand how you elevate healthcare. That was a really important meeting from what I could see. There's not enough of that. So if you want to know why some of the companies, they used to do it. I can say I was involved in it years ago. 20 years ago I was involved in it. They used to do it. They don't do it anymore because it's just about cost compression. And what they're not understanding is that it's that intimacy with the customer. It's that support and building of the customer that is where the massive value comes in, and where customers want to stay with you, work with you, be with you. So I think there has to be a radical rechange. First of all, we need to bring back the people that utterly and totally understand this business. And we need to promote people based on their capabilities, not upon their political abilities. We need to make sure that we've got people in the management positions where a sales team or a marketing team look up to them and say, yeah, this is a person that knows this. This is a person that understands my daily grind. This is a person that understands my challenges every single day. And unless we get to that, and they look up and they say, yeah, this is just a politician who's on the next 2-year thing for the step on the ladder for their next promotion, which is what everybody thinks, then these companies are just going to fade away and become nothing. And there's going to be a whole new raft of companies that are going to come up, understand the market, the product, the customer, the business, and they'll have very competent people that have left those big companies. And you're going to see more and more of these smaller companies are going to become the experts in the field that the surgeons want to be with. So again, what I think is wrong with the industry, I think that we've got far too many politicians as managers. I think we've lost the competency, the confidence in the products, the procedures, and we have to go back to basics. We have to go back to getting people throughout the entire organization connected to the business every day. Get them out from behind the desks and get them in the OR. And I think if we can do that, then there is some chance. If we don't do that, then even the biggest of the biggest companies are just going to fade away.